and you have to go out and get health insurance, where do you start? What should my deductible be? You have to call each individual health plan, Blue Shield, Blue Cross, Kaiser, if you want to try to get anything through them, and or any other health plan, Aetna, and on and on and on. And you have to basically create your own table. And if you're good at it, you may put it on a spreadsheet. This is all done for you. And it's just based on those simple, probably not more than, if you looked at it, maybe eight or 10 questions or something like that.
And then when you go to these sites, are these different agencies now? Is it a government agency, or is it still Blue Shield and all the usual ones that we see that are now offering these programs? Are we going to see all new names of companies, or is it the same companies just doing it differently?
I think it's the same companies doing it differently. I can only speak to California. So in our region, which I think is called Region 12 or something really attractive like that, which includes Ventura, Santa Barbara, and San Luis Obispo counties. You go there and you've got Blue Shield, Blue Cross, Kaiser, which mainly covers down in the Ventura area. And when the state of California said to the healthcare plans, we want you to put together a proposal, and they broke it down into regions. So now basically what you're doing is you're buying that plan from that insurer off basically a controlled market where you can, again, make comparisons. There's been some concerns raised about the availability of the provider network. Do they really have contracts with all the providers that they need in order to provide these services? And that still has to be worked out. Remember that the plans only have to start covering in January. So I think they're still negotiating back with some of their existing provider networks.
When you say provider, please clarify that.
Yeah, thank you. Sorry about that. It's physicians. So as a healthcare plan, you have to have a network of physicians and specialists and resources, everything, from radiology and with radiology, regular x-rays or CAT scans or MRIs. But you have to basically show in this case, the state of California, the Department of Managed Healthcare, your ability to meet what's called network adequacy. In other words, you've got the plans, you've got the premiums all lined up. Do you have the network of physicians and equipment that you can now provide these services? So there's been some criticism by the physician groups that there may not be the network of physicians to help get new members' services, but that's going to be something that they're going to have to address.